You are watching McLaren Port Huron Today's Health, and in today's program, I'm speaking with fellowship-trained orthopedic hand and upper extremity surgeon, Dr. Devin Banda, about conditions affecting the upper arm. And in this segment, we're talking about nerve conditions. Dr. Banda, can you explain what common nerve conditions affect the upper arm?
Yeah, so nerve compression neuropathies are typically some of the most common things that we treat in hand and upper extremity, with the most common being carpal tunnel, which is compression of the median nerve. But the other nerves in the upper extremity can also have compressive disorders, like cubital tunnel for the ulnar nerve and radial tunnel for the radial nerve.
And what kind of symptoms, like if we're talking about carpal tunnel, what kind of symptoms would someone have?
And so with carpal tunnel, typically the hallmark sign of carpal tunnel is pain and numbness in the fingertips. And with carpal tunnel, you have typically a specific distribution of that numbness. With the way that the median nerve is wired in our anatomy in the hand, it typically involves the thumb, index, middle, and radial portion of the ring finger. It's not always that way. Some of us are wired a little bit differently, but that's the most common kind of pattern that we see. And the typical symptoms that patients might be experiencing, and the most common is probably nighttime symptoms, where they're waking up with a numb hand, where they kind of have to wake it up and shake it out, or if they're doing any type of repetitive activities, or if they have any prior injury to that kind of area where the carpal tunnel is, or in the arm or hand itself.
Are certain people more at risk? Like I think about the people that type a lot. Are they more at risk for carpal tunnel?
Yes, yeah. So people that do kind of repetitive tasks, specifically at work, or if they're doing any hobbies that require kind of repetitive motion of the wrist, they're definitely at a higher risk for developing carpal tunnel syndrome.
And how do you diagnose it?
So diagnosis is typically done just clinically through physical exam, and then sometimes as well you can order additional testing like a nerve conduction test, which basically looks at the functioning or the functionality of the nerve to give us a better kind of objective thing to look at to guide us in the right diagnosis direction.
And what do treatment options look like? So
treatment options with carpal tunnel typically are initially conservative treatment in the forms of nighttime splinting to immobilize the wrist specifically when you sleep to try and take tension off of the nerve. And then you can also try some steroid injections for more conservative type of treatment. And if those modalities don't work, then there's always surgical options as well to address the patient's symptoms.
And is there a new endoscopic technique that you use for carpal tunnel?
Yep, so there's typically two different ways that you can approach carpal tunnel syndrome surgically, and that's either with the open technique or the endoscopic technique. They both have been around for a while. Open has been around for longer than endoscopic, but endoscopic has been in practice for decades at this point, but is really starting to gain a lot of popularity as new literature comes out. With endoscopic technique, the big benefit to the endoscopic approach to carpal tunnel is a quicker recovery. Studies have shown that there's a quicker return to work and less healing time associated with endoscopic, mainly due to its kind of minimally invasive approach and smaller incision. They have studies that look at both kind of long-term outcomes between open and endoscopic, and usually at the 1-year mark, patients do about equal, but the big benefit with the endoscopic is a quicker recovery.
And so, like in terms of weeks or days, like how long would someone be need recovery?
Yep. Yeah. So again, it really kind of depends from patient to patient, depending on the severity and the length that they've had the symptoms. But there's not really a whole lot of restrictions that we place on you after surgery. But it's typically a couple of week recovery until you start really gaining a lot better function of your hand, and that's usually a little bit quicker with the endoscopic technique compared to the open technique.
So how do patients, or how do you help patients decide when it's time to do surgery?
Yeah, so obviously that's a conversation that will be individual to each patient, but really once patients are having kind of more persistent symptoms and they've failed that conservative type of treatment that we talked about, consisting of the anti-inflammatories, the splinting, and a possible steroid injection, and it's really starting to interfere with their daily activities, is when we go to surgical treatment.
So you had mentioned earlier cubital tunnel syndrome. Can you explain what that is?
Yep, so cubital tunnel syndrome is a compressive neuropathy of the ulnar nerve at the level of the elbow. And it's not quite as common as carpal tunnel, but it's still one of the most common neuropathies that we see in the upper extremity. And it's similar to carpal tunnel, that's involving the ulnar nerve traveling through the cubital tunnel on the inside aspect of the elbow. And if there's too much tension on that nerve, that can cause numbness and tingling and pain that typically involves the ulnar digits in the hand, and that's being the small finger and then the ulnar portion of the radial digit, or of the ring finger. Sorry.
So does that, similar like to carpal tunnel, is that like from repetitive injury as well, or?
Yep, yeah, so repetitive injury, if there's any history of trauma or arthritic conditions around the elbow causing inflammation or putting pressure on the nerve are definitely causes of it.
And is that diagnosed similarly to carpal tunnel?
Yep, yeah, very similarly diagnosed through clinically or a clinical evaluation, physical examination, and then with nerve testing if indicated as well.
And are the non-surgical options similar as well?
So they're slightly different, but with cubital tunnel syndrome, typically it involves the type of movements that keep the elbow flexed for prolonged periods of time. So a lot of times, similar to carpal tunnel, we'll try some nighttime splinting with the elbow kind of splinted in a less flexed position. And then if you fail conservative treatment, then surgical options exist as well.
And what would those entail?
So that typically involves an open approach, just releasing the actual cubital tunnel where the ulnar nerve gets compressed at different locations along its course down the upper extremity.
And for both of these surgeries, do patients feel relief like right away, or does it take a little while?
Yeah, so it will really depend on the severity of the symptoms, but typically with carpal tunnel syndrome, they will notice a difference pretty quickly. The first thing typically that patients tell us that they notice a difference in is the nighttime symptoms, and then further down, as they begin to heal and progress, the numbness and the tingling should definitely decrease.
And probably improve range of motion overall.
Correct, yep.
Yep, great. Thank you for sharing this information with our audience.
No problem, thank you for having me.
And thank you for watching this episode of McLaren Port Huron Today's Health. If you have questions about the program or ideas for future topics, be sure to contact us through our website at www.mclaren.org/PH contact. As always, be sure to tune in next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.
You're doing everything you can to keep yourself and your family as safe and healthy as possible. But staying healthy also means getting the medical care you need when you need it. At McLaren, we want to reassure anyone experiencing a health concern that you don't need to delay seeking treatment. We're doing what's best for our patients and employees by following the most current CDC safety guidelines. You don't need to wait, because at McLaren, we are committed to keeping you safe while giving you the expert care you need.